You're tired all the time. You feel unmotivated, emotionally flat, maybe even hopeless. But here's the question. Are you just sleep deprived? Or are you actually depressed? The symptoms can look eerily similar, and if you get them confused, you might try to fix the wrong thing. So, in today's video, we're going to discuss how to tell the difference between sleep deprivation and depression, how they influence each other, and what steps you can take to feel like yourself again. Why does the confusion happen? Sleep and mood are deeply connected. When you're sleep deprived, your brain struggles to regulate emotions, focus, and energy. The same things that are affected in depression. Studies show that just one night of poor sleep can reduce emotional resilience and increase feelings of irritability and sadness. Over time, chronic sleep loss can mimic many signs of clinical depression: lack of motivation, low mood, difficulty concentrating, and a sense of hopelessness. So if you're only looking at surface-level symptoms, it's easy to mix the two up. What are the core signs of sleep deprivation? Let's break down what sleep deprivation actually looks like. It usually involves excessive daytime sleepiness, slowed thinking and reaction time, forgetfulness or mental fog, irritability and low frustration tolerance, strong cravings for sugar or caffeine, physical fatigue without a specific emotional cause. What's key here is that the tiredness comes first, and when you do finally sleep well, you usually feel noticeably better. Your mood lifts, your mind clears, and your body feels more alive. That's a good sign that the problem is sleep, not a deeper mood disorder. Now let's talk about clinical depression, also known as major depressive disorder. While sleep issues are a big part of it, depression includes a broader and more persistent pattern of emotional symptoms, such as a deep sense of sadness, emptiness, or numbness, loss of interest or pleasure in things you used to enjoy, feelings of worthlessness or guilt, physical changes in appetite or weight, thoughts of hopelessness or self-harm, and yes, either insomnia or sleeping too much. The key difference. These symptoms last at least 2 weeks, are present most of the day, and don't go away even after a good night's sleep. Here's where it gets tricky. Sleep deprivation can cause depression, and depression can cause sleep problems. In fact, about 75% of people with depression also experience sleep disturbances. And chronic poor sleep increases your risk of developing depression by affecting serotonin regulation, brain inflammation, and your ability to manage stress. It can become a vicious cycle. Sleep loss fuels low mood, and low mood disrupts your ability to rest. This is why addressing both sleep and mood is often necessary for full recovery. If you're unsure which one you're dealing with, ask yourself, do I feel significantly better after a few nights of good sleep? Am I enjoying anything lately? Even a little bit? Do I feel emotionally down or just physically drained? Are my thoughts unusually dark or self-critical? Have I lost interest in things that used to bring me joy? If your fatigue comes with emotional heaviness, numbness, or hopelessness that doesn't lift with rest, depression may be playing a larger role. Signs. It's time to seek help. It's always okay to seek help, even if you're unsure what's going on. But definitely reach out if your mood is low. Most days, you're struggling to get out of bed or care for yourself. You're experiencing sleep disruptions for weeks on end. You've had thoughts of self-harm or giving up. A mental health professional can help clarify what's happening and create a plan that addresses both mood and sleep. Therapy, lifestyle changes, and sometimes medication can make a world of difference, especially when tailored to you. Small shifts that help both sleep and depression. Here's the good news. Certain habits support both sleep and mental health. You can start with keeping a consistent sleep schedule even on weekends. Getting sunlight first thing in the morning, which boosts melatonin and mood-limiting screen time before bed. Exercising regularly, even if it's just a walk. Practicing mindfulness or breathing exercises to calm the mind before sleep. Cutting back on caffeine or alcohol, which can disrupt deep sleep. You don't need to overhaul your life overnight. Just 1 or 2 small changes can start to shift your internal chemistry. And that shift matters. So how do you tell the difference between sleep deprivation and depression? You listen, not just to your mind, but to your body. You notice patterns. You track how rest affects your mood. And most of all, you give yourself permission to ask for help. Whether it's sleep, depression, or a mix of both, you deserve support. Healing begins with awareness, and today you've already taken the first step. If you found this video helpful, please give it a like, share, and subscribe for more. Be sure to check out our other mental health education videos.